Aho's check sends Reinhart to the room. Welcome back everyone, my name is Dr. Stephen Wilson, and here on this channel we analyze the science of sports injuries on video. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. We're taking a look at Game 2 of the Panthers-Hurricanes in Eastern Conference Final. We're looking at the puck carrier here. That's Sam Reinhart, number 13 of the Panthers. He is in the middle of the three Panthers. He's coming across the blue line. He makes the pass over to his right side, and then he tracks the puck with his eyes here. Seemingly, maybe he's wanting to make sure the play is staying on side. What he doesn't see is Sebastian Aho of the Carolina Hurricanes coming in from the left side of the screen, coming across to his right. He's going to make contact with the left side of Sam Reinhart, and there's the impact that we see of Reinhart's left side absorbing the left-sided check from Aho, who's leading with his left hip. We can look at the point of impact, which is right on the outside of Reinhart's left thigh, just above his knee. There's the impact, and it is significant enough. If we look at Reinhart's left foot, look at his left skate. When the impact occurs, that causes his toe to go into the ice and his heel to come up off of the ice, turning his leg into internal rotated position here, with his left knee almost collapsing inwards. We call that a valgus stress. When a force comes from the outside or the lateral part of the leg across towards the midline of the body, forcing his knee to collapse inwards, that is a valgus or a dynamic valgus stress from the outside of the lateral part of his knee, causing his knee to fold and to buckle and to collapse inwards, as we see on this play. We'll take a look at another angle and we can further view exactly how Reinhart's knee reacted to the hit from Aho. So the view that we have here is a little blurry, but it's from the front of the play. So here we see Sam Reinhart. He made the pass. It's going towards the left side of the screen. And here we see the Hurricanes player Aho leading with his backside. He's going to come in and make contact with the left side of Reinhart, again just above his left knee. He goes out of the frame here a bit, but then his left leg, we can kind of see it just barely here, but we can see the angulation of his left knee that is way beyond a normal Q angle, what we would call it. We can see that folding of his left knee inwards from that lateral or valgus stress from the outside, and that is going to cause the inside part of his knee to almost separate and to open up, and that's going to stress three very important structures on this play into Reinhart's left knee. I do want to mention his anterior cruciate ligament, his medial cruciate ligament, and his medial meniscus. Reinhart will be examined tomorrow, according to Panthers head coach Paul Maurice, meaning he'll undergo diagnostic imaging tomorrow, most likely an MRI, to see the extent of the damage to those ligaments and meniscus to the inside part of his knee. We're going to take a look at the anatomy screen, and I'll show you exactly what area of the knee that we're talking about here. The skeleton here, we'll pretend this is Sam Reinhart coming across the blue line. He made that pass to his right, and then Sebastian Aho came in and led with his backside, making contact with the outside part of Reinhart's left knee. So we're going to look at the left knee a little bit more closely here. We're going to zoom in and we orient ourselves. Right here, this is the left knee. We can see the kneecap and the patella right in the front. The femur is the large thigh bone here on top, and then the tibia and the fibula running parallel to that below the knee down into the ankle and the foot, of course. So when Aho made contact with Reinhart's left leg, that force came in from this direction here, which of course forced Reinhart's knee to buckle and to cave inwards from that outside lateral valgus stress, causing his knee to move this way, stressing his medial collateral ligament, his anterior cruciate ligament, and his medial meniscus. Those three structures are a concern at this point for Reinhart, as all three may have endured stress from that outside hit from Sebastian Aho. We await word from the Panthers on the results of the diagnostic imaging for Sam Reinhart that will be taking place on Friday. Likely Reinhart at the minimum will have a sprain to one of those ligaments, and at the most a tear. He is likely to miss at least, at a minimum, a bit of time in this series. Thank you very much for watching. Have a great night. Please be well.